The Charlotte Ledger Podcast is a member of the Queen City Podcast Network.
This episode of the Charlotte Ledger Podcast is sponsored by Childcare Search. Finding childcare is more than checking a box. It's peace of mind. For over 40 years, Childcare Search, a service of Childcare Resources Incorporated, has helped families find safe, nurturing, quality childcare options. Their free referral service connects you to licensed programs that fit your family's needs. Visit findchildcarenc.org or call 1-888-600-1685 to talk to a childcare navigator today.
Welcome to the Charlotte Ledger Podcast. I'm Steve Dunn. To find out more about the Charlotte Ledger, visit thecharlotteledger.com. I'm joined today by Dr. Carlos Jorge, the Chief Medical Officer of Companion Health, and his wife, Nathalie Simmons Jorge, the Chief Executive Officer of Companion Health, a boutique concierge medical clinic in Charlotte that combines the best of conventional primary care medicine with the best of functional medicine. Welcome, Carlos and Nathalie.
Thanks for having us.
Thanks.
Appreciate it.
What does it mean to put the human back in healthcare?
It's something that we have focused on since we started Companion Health back now over 5 years. And it really, the origin for it is having been in Charlotte as long as we've had. I've worked in both systems, worked in private insurance, that model of sort of volume-based care, and was really finding just a huge disconnect in how we were taking care of people in front of us. And so at a point, you come to a realization that we're just sort of kind of doing rote behaviors of taking care of people, but we're not really experiencing that connection that you really want to have as a physician and patient or client that's in front of you. So for us, when we started creating Companion Health, we really wanted to obviously do excellent medicine, do excellent functional medicine, but really try to create something that would be unique in how we interact with our clients and the people who work with us and are part of our team. I think that's sort of the whole concept of human back in healthcare.
Well, and one of the first things that our clients, when they first start working with us, they're amazed by the fact that the provider just listens to them and acknowledges where they've been and spends an inordinate amount of time in conversation versus going directly into, here's a prescription, here's a procedure, here's a referral. So there's a real getting to know you and what got you to the place you are. A lot of our clients have experienced just nobody being able to figure out what's going on with them. And just having someone listen and not immediately say, here's an antidepressant or here's some other solution. Let's figure out what might be at the root cause. It really establishes more of a collaboration and a relationship than a top-down, get you through the system kind of.
Well, this not being able to figure out what's going on with you is a personal thing for you, right? You had a child who had a hard time figuring out a diagnosis, and that was one of the things that talk us through about that experience and how that led into what you're doing today.
Yeah. I mean, our youngest from early on had what you could describe as like weird vomiting episodes that over time, after having gone through seeing specialists and seeing different pediatricians, the answers that we were being given just didn't make sense to both of us. And so for me, I started doing a lot of the research on what ultimately the diagnosis was, which is something called cyclic vomiting syndrome, which is a precursor for migraine headaches as well. And so she has had migraine headaches, now very well controlled with nutrition and diet and making very positive changes. So for us, it meant really looking at everything that we were introducing into the home from, not only food, but cleaning products and other things. And so that journey of, cleaning up our environment started for us probably over, 15 years ago. And we've just carried it forward. And then Nathalie, proactively has done a lot too.
Being the mother
mom.
hen, yes,
Yeah.
I started reading. And once you learn about these things, you really can't turn back and go backwards. So the more I read, the more I realized that we really had a lot of lifestyle components that were not addressed in the medical model, that because there's no money to be made by necessarily saying, hey, why don't we look at the food that you're really eating and the ingredient list? Maybe you need to drink some more water. Water's free, unless you, I guess.
Water's good stuff, right?
It's good stuff.
We're all literally made of water, right?
Yes. So there were all these things that were pretty basic, but in terms of the impact they could have on our child and ultimately our own health, they were significant. And so we wanted to make sure that it's not as easy as just saying, hey, start drinking more water or you need to clean up your diet. We often have to help people get to that place and put some of the architecture in place to help support them and the accountability in place. So it's easy for me to say I should go eat some broccoli, but am I going to do it? I don't know.
You got to find a way.
You got to find a way.
So I'd like to talk about what a concierge practice is, right? So I think probably most of us who go to traditional medical practices are familiar with the experience of showing up, being kind of cranked through, right? The perception is that the business model is to see as many patients as possible, and that it's also related to sort of treating symptoms, right? That you're reacting to, if I'm going to the doctor, it's because something's gone wrong, right? There's some problem, right. And I'm talking to somebody who's pretty narrowly focused on that problem and solving that problem or helping with that problem, but in a high volume kind of way, right? And my understanding from the outside looking in the concierge practice is that it's certainly you have a longstanding relationship with somebody who's interested in your total health, right? Not just one piece of it. And you alluded to spending time and taking time to really get to know somebody. Right. What are the other attributes of your approach?
Yeah, I think if you start with where we are in the traditional medical practice, I think there are different types of concierge practices. Some of them, I would say, tout, hey, you're going to get easier access. So access may be the concierge level of service. The time spent may be a little bit longer, and that's another type of concierge practice. For us, the way we really designed it is we wanted to have all of those factors. So we want to spend a lot of time with our clients. We spend anywhere between an hour and a half to 2.5 hours on the first visit. We're also very proactive in seeing we call them clients, not patients.
I noticed. Yeah.
And I know it gets a little controversial among the medical world, but the reason I say that is that a lot of our clients also come to us in good health and just want to figure out how to further optimize their health. And so for us, the way we think about our concierge services is we want to be a high touch, high sort of intentional with the time and the services that we're giving our clients. So if we, like Nathalie just mentioned, if we say, hey, we're going to talk about a better nutrition program for you, we are going to build that for them over the next several months, weeks, et cetera, with the team that we have. So the team being the physician or the PA provider, soon to be a nurse practitioner that we're bringing on as well, and then an integrative coach that is part of that team to help them have success. The other concierge piece is that, yes, we are there when they need us. If they're traveling in Europe and they get sick, we want them reaching out to us, and we want to try to coordinate care if necessary. If we have to get someone, flown back over to get treatment, which we've done, we help coordinate all those things. So it's that also level of service, finding the best of, PTs or, hey, I need to see a specialist. Okay. Are they here in Charlotte? Which they often are. We have great support services in Charlotte. And sometimes we don't, and we have to send them to, a Mayo clinic or something like that. So that's, I think, the level of service from the concierge piece that we do.
Nathalie, there's a business aspect to it too, right? Like where the money comes from. Do you accept insurance?
We do not accept insurance, not for our services, because really what our clients are paying for is that expertise and that advocacy, navigating through what I'd call the quagmire of misinformation. And also they need support getting to the right specialist and such. So a lot of what we do is behind the scenes. It's not just patient facing or client facing in our case. I think that we should also talk a little bit about the other aspect that we offer a companion in addition to traditional concierge care, which is the functional medicine piece, which is really modern medicine. It is evidence-based, and it is not necessarily been adapted by standard of care medicine. So I think Carlos would be the right person to talk a little bit more about what we do on that front.
Yeah. And I look at functional medicine. People often ask, well, what does that mean? And for me now, more and more, I just say it's the way medicine should be. It's medicine where we really want to understand the why, like what happened to Steve that he fell out of optimal health. Like what were the factors that drove that, for example? And once we start kind of chipping away at what those factors are, we are way more informed and able to make better decisions into the treatment protocols. And the treatment protocols in functional medicine are not ignoring traditional allopathic Western medicine. No, we want to find a way to really integrate all of those factors. However, in the functional world, we want to understand the function. What is going on in your system? So is it your gut? Is it your hormones? Neurotransmitters? Have you had some other exposures? Long COVID now that a lot of us are so familiar with. Like, what does that do to your system? And how do we then start chipping away at those things so we actually get you back to optimal health? And that may happen for some people quickly, but the reality is to truly make long-lasting change in that functional way, it's a process. And I think that process also, a lot of our clients realize, hey, we are investing because this is a lifetime change that they want to accomplish.
It's from a business standpoint, there's a natural and predictable relationship between where the money comes from and how you do what you do, right? So for example, in the Charlotte Ledger, the vast majority of our money comes from subscriptions and not advertising. It's one model versus another. And our view is that results in a certain kind of product, right? One that is aligned with the interests of the readers and not confused in terms of its alignment, right? And so I wonder, from your perspective, if that is true in regard to the American healthcare system being organized around insurance versus sort of direct payment, right? And if you see your ability to care for clients in the way that you think is for the best, if that is one of the consequences of just taking direct payment.
Absolutely. It's why we take a subscription versus any money from any of the other players, because there's no conflict of interest. We put our clients first, the integrity of our care, and the way that we're focusing on their health outcomes is what feeds us.
And you alluded to this a little bit. You're not beholden to any particular group either, right? So whoever the best specialist is or whatever, whoever they might be affiliated with, that's not a concern for you in the same way that it might be somebody who's like part of their same sort of corporation.
I mean, we have a certain market in which we're operating, and our clients need access to imaging and the Novants and the Atriums, and they're going to provide that imaging. So we need to have good relationships with them, but there's no incentive for us to send our client to one or the other. It really is if they live near a certain imaging center, if their insurance is going to pay for it. We're trying to help them navigate through the system and advocate for them in the system. So I'll give an example of if one of our clients is needing advanced imaging faster because they're scared and they have maybe a cancer scare, we're picking up the phone. I've watched our providers do it on behalf of the client and trying to find someone to get them not only seen and imaged, but also the imaging read. So we do that level of advocacy for our clients, and that's what they're paying for, in addition to this expertise in terms of looking at, I give the example of, like, if someone has high blood pressure, this is what Carlos was talking about. Why do they have high blood pressure? Is it genetics, or is it because they're not sleeping, or is it because they're really stressed, or their diet is poor? And it could be something that happens over a number of years. And it's often a combination of things. And it's understanding, let's start teasing out. Because Carlos does allopathic medicine, as does all our providers, they may very well need to be on a medication to manage the blood pressure. But as we start to make lifestyle changes with the support of a coach and the provider in tandem, they may eventually be off that medication. So it's additionally that kind of level of work that we can do.
You got a lot of coaches. You got a physician and a PA who's a physician associate, right? Mm-hmm. And then a bunch of coaches. So how does that work? If I come and become a subscriber or become a client of yours, who am I working with, and what does that look like?
So you're directly working, obviously, with me as the physician or the PA, and we work, obviously, in tandem. And then you are assigned a coach. That coach becomes your right hand, in a sense. So if we say, Steve, we're picking on you after we were talking.
You really are. Natalie was looking at me accusingly. And just for our listeners, Natalie noticed that I sent an email related to this interview at 1 a.m. and she pointed that out to me. And I've heard about the snacks already that we offer at the office here in our South Park location. So you are definitely you're dedicated to your mission all the time, and with everybody. I'm not even paying you to be berated by you for it. So these coaches, they scold you,
gently reinforce.
Oh, okay,
that's how we say it. No, so your coach is going to say, all right, Steve, let's talk about the sleep. So let's understand. What is your sleep cycle? Why is sleep important? What are the things and behaviors that we could start doing to, assist with better sleep habits? Is it the room? Is it the environment? Is it you're checking your phone too much? So your coach becomes that guide. And also we have built a huge database for our coaches to be able to give you all the resources that you need. Are they, hey, I want to learn how to cook a leaner meal at night. Okay, well, here are 30 so that is the level of coaching that we want to have. And all of our clients get a coach assigned. They can use that coach as frequently as they want, or some have, they're pretty intense in the first few months, and then it starts kind of going out a little bit, and they call upon the coach when they feel like they may need them as well.
Is it all part of a subscription? Do people pay monthly and all this is included? Is that the way it goes?
Yeah.
Yeah. It's all included. And that's the difference too for us, and kind of back to the insurance question. The motivation for the insurance model, it's there. It's a necessary evil that a lot of people have. We have insurance. We have it for our employees. And yet I feel the level of service that we are able to do, it's an investment for our clients to do this. And we recognize that. And that's another reason we take what we do so seriously. And we care about it so much, because we know that they are choosing to invest financially and time to be part of what we're doing. And if we didn't respect that greatly, we would not have the growth that we've seen.
Steve, I often use an analogy that we think about 401ks and investing in them early in life, because we want to compound the interest and ultimately have this big nest egg. We don't necessarily think about our health in the same regards, but really when we're in our 20s, we're setting ourselves up for our 30s and our 40s and our 50s. And so we encourage our clients to make those deposits to their health wealth accounts. And if they've drained them over the years by pushing, burning both ends of the candle and working really hard and saying I'll exercise when I'm older and I'll sleep when I'm older and all these things, then they have some catch up to do. So they're going to have to make heavier investments later in life so that those compound positively in their direction. What's great is it's never too late to get started on a health journey. It's just the sooner you do it is always the better.
We'll be right back to the conversation, but first, this episode of the Charlotte Ledger podcast is presented by Childcare Search, Charlotte's trusted childcare guidance for families.
I'm very interested in why things are the way they are and what are the incentives that are lurking behind. And there's so much in the world that we just take for granted just because we're used to it. And I think just the idea that you have insurance that covers almost every aspect of healthcare is just something that we just take for granted, but it's far from the only way of doing it. And so when we look at why our experience of being consumers of healthcare is what it is, it seems to me it's because you've got healthcare providers and insurance companies and the patient or the client are sort of in this three-way kind of relationship where each is trying to get as much as possible from the other two. And the healthcare providers and the insurance companies are professionals at this. This is their business. Whereas most of us as the patients or the consumers, we don't speak the language. We don't know how we're getting played really a lot of the time. Another thing that I think informs the way things are is this tension between the individual's interests and sort of like society's interest, right? And so, for example, if there is, I hear about people like going to Japan and getting like full body scans, right? Because it's like pretty affordable, and it's something that, generally like people who are well off will do because they think it's in their best interest. It's not the recommended course of treatment, I think, in this country, because it's expensive, leads to a lot of false positives. Sometimes you run down, you get worried about something that you really don't need to be worried about. But I'm wondering whether it's in regard to testing or other aspects of medical services, whether the fact that something only benefits, like, say, 1 out of 20 people, so we don't do it,
Right.
that's great for society at large, but it's not so great for that 1 out of 20 people, right? And I wonder how that dynamic affects or, intersects with your practice and how you do things.
We could probably have a really
this
long
is
conversation about.
We could talk about it, but
Let's talk about it.
I'll start with saying I think the way to think about the healthcare world, especially in the United States, it's the medical industrial complex in a sense, right? So you have insurance companies, which are the biggest players. They are big, big, big. You have hospital systems. Let's not ignore them. Atrium, Novant, other big Cleveland Clinic. These are huge systems. You have pharmacy benefit managers. You have the big pharmaceutical companies. You have employee benefits. I mean, so there's a lot of players. And then, yes, you have physician groups. You have now also external capital coming into buying large medical practices.
Right.
So there is a lot of financial incentive to keep that system operating the way it is. It's not a conspiracy thing that I'm talking about. It's just, it is what it is.
Everybody's responding to their incentives.
Right. We spend 20% of our GDP on healthcare, and we have some of the worst outcomes in the world. Now, what we chose to do is we said, and I said it, I was ready to leave medicine because I was so tired of that kind of, hamster wheel industrial complex. We are taking what we do outside of that. Now, we play with that system when we need to. If I need to send Steve to go get an MRI because I'm concerned about something, then we're going to use the system that exists. Now, the other question about testing or doing things that aren't necessarily standard of care, or there's not, double-blinded placebo-controlled trials for everything.
Right.
It goes to what we think is really important, which is the N of 1 is Steve sitting in front of me. And if the N of 1 says, hey, I'm really worried that I may have something, well, then you know what? Hey, there is a way that we can get a full body MRI if we need to. Understand, it may not give us all the answers and it may cause you more stress. But the difference is we're having that conversation and we're spending time understanding the nervousness that Steve, you may be having regarding something. Okay. And so the complexity of our healthcare system also, I think, is a huge issue that, as you said, most people don't know how to navigate it. Like, I have a hard time when I took our oldest one time for strep throat and I got a bill from, multiple things. And I was like, what the heck is all this? Like, I know how much it costs to do this test and they're asking me to pay this much. Like, so even someone as informed as I am can still have issues navigating.
We were in a car accident that resulted in a lot of medical bills. I'm a lawyer. My wife is a physician. Yeah. We had a hard time navigating the thing. And I just thought, how does anyone out there in the world get through it? With a lawyer and a doctor can't make sense of it and can't get anywhere. And we're spending all this time on the phone. And the invoices are all just, frankly, just aspirational nonsense that nobody really pays. You know what I mean? There's just all this hidden, and that's what I meant about how the people who do this for a living, like, they know the game that they're in, but the general public just, we don't even know.
And that's why I think that's why there's such amount of just people so frustrated with this system, and people are so tired and wanting to look for, other solutions. And sometimes the solutions being offered may not be the best or the right ones. And so how do we really, with our clients, help them navigate a lot of the fluff that's out there or, wrong data and say, no, wait, like, yes, this is something that is getting a lot of attention, but let's understand, how do we navigate your health the right way? And that's kind of how we try to reinforce and lead our clients.
And from where we're going aspirationally, we really want to influence and transform healthcare. We want to be able to scale what we're doing at a very boutique level and either help other practitioners or employers or other systems that want to bring healthcare the way we're bringing it to our clients and enable them to do so. So our long-term aspirations really are to put the human back in healthcare, not just in Charlotte, North Carolina, but everywhere we can. We want to create a footprint. So we do speaking engagements, we do advisory services. So we're looking to change the name, the needle here on where we're going as a society. I often give the analogy too, if we think about auto insurance, you mentioned, I'm sorry you were in a auto accident. We don't think about our cars the same way as we think about our bodies.
That's right. Yep.
We use auto insurance if we get in a wreck or a tree falls on our car, but we don't really use it to, make sure there's air in the tires or replace the engine oil.
Changes, like washer fluid, but that is our American healthcare system.
That is our healthcare system. And we do preventive maintenance on our cars, and we can get another car, but we can't get another body. And you talked about community, and it's not just the N of one, Steve, but our whole community our health is connected to each other and the health of the planet. And we have to think bigger than just ourselves.
Carlos, you mentioned that there's some controversy around the concept of referring to the people that you work with as patients versus clients or clients versus patients. What's that about?
I think it's just kind of the medical profession where, we've been so used to really addressing folks as, patients. That's one. Two,
a couple of things.
Client also reflects they are paying
They're
for
in
our
charge.
services directly. And so, as a physician, and I think maybe now newer grads coming out, maybe are getting a little bit more of the financial education. For me, obviously having, a partner who's an MBA and has done companies and built, structures before is super beneficial. But the conversation about finances for the person sitting across from you is always a very interesting, challenging one. And as a physician, that's not how we're trained. We're not trained to say, hey, Steve, yes, to hire me, it's going to be this much. It costs this much. Like, it's a weird conversation. And I think a lot of physicians, some would say we shouldn't be having that conversation. And I don't necessarily agree. I think we have a robust experience. We have years of time that we've spent, and we have to be comfortable in understanding what the value that we are offering and the services that we are offering, especially in the setting that we're doing it, which is not tied to, X insurance company or X system that is saying, this is what you're worth. And so I think the word client also allows us to meet you where you are. And I'm not assuming that you're already sick or there's something wrong with you. You're hiring me to help you improve your health. What does that mean? And that's how I think we frame it.
It puts it more on an equal playing field. I think traditionally doctors have been sort of, up here telling people what to do, more directing, and we're more guides and support and advocacy. And so it changes the dynamic of the relationship to be more collaborative.
And there are times when I will say, as a physician, I will say, Steve, no, we have to do this. This is the data for this is.
I was going to get to that with you, because part of what you're talking about is the business relationship. And as the husband of a physician and the friend of many physicians, nothing but love from physicians. But there sometimes is this sense of sort of denial about the fact that they're in business and that it is a business, and that whether they see themselves as being in business. Have you ever heard, it's like, just because you're not interested in politics doesn't mean politics isn't interested in you. Like, you could be a physician and not think that you're in business, but it doesn't change the fact that you are in business and your business interests are affecting you and everything you do, whether you want to understand that or not. So that's part of it. And then I think another part of it is the sense of authority and of not just providing a service to a client just because that's what the client wants, right? You have your own independent professional judgment that's implicated. You have your own obligation ethically to the profession and to the truth, in a sense. Interestingly, we as lawyers, we don't have any problem with this. We always call our clients clients. We also have professional judgment. Yeah. We don't do everything our client wants us to do. But what's it like for you in a concierge medical practice? If I come into you, and I've been on the internet doing my own research, and I've concluded that there's some therapy that I want for myself. How do you handle it?
I ask you to show me what you're researching, look at the sources, understand what's the motivation that you have to bring that to me. Have we not looked at something with you already to potentially address this? And then my role is to sort of either help you understand that the validity or the scientific rigor behind what you're bringing to me for your personal health may not be beneficial. I'll give not to go down too much of the rabbit hole, but like there are treatments that people were doing for COVID. It's not to say that the medicines that some folks were using alternatively do not have roles in certain things, but it's understanding how do we deploy those medicines in actually the right way to not create more problems for someone. So, we are very, very intentional about not promoting things that don't have a lot of data behind them. And in functional medicine, one of the challenges that we have me as a physician is that there are a lot of functional providers out there, quote unquote. It doesn't mean they don't have deep knowledge, deep intelligence, but often we have to help our clients understand that not everything that is being targeted as medicine or practice of medicine is actually got the scientific rigor behind it to act upon. So that's a conversation. That takes time. That takes me researching. That takes me sort of doing extra studying and classes and understanding all those things so that we're able to provide for you, Steve, the right answer to what you've been researching.
We get a lot of social media influencer questions. There's a lot of that comes to you, I would say, Carlos, of I heard this person is doing this. I want to do this. And it is navigating through that. Is there evidence to support what they're doing? Is it right for you? What's right for one person may be not right for another person. So it takes a lot of time to help someone understand what's in their best interest. And it gets back to the integrity of the care we're providing. It's not just we're selling services. You talked about the business of medicine. So we're very sensitive to the fact that we are taking care of human lives and the science behind the medicine we're delivering. Carlos as is Anya, our physician associate. They are really, really strong research scientists. I think it's a rare combination to have a clinician who is in as much data as these two are and really trying to figure out what's in the best interest of the client and also sometimes say, I don't know. I think it's really hard to say, I don't know. I have to look into that more.
Yeah. It
that's
happens.
something you say often.
Yeah, we have to.
Well, I feel like we've done a lot today. I feel like we've solved the American healthcare system.
Right. Yes.
I feel like my own personal health has improved. I know I'll be getting better sleep and hydrating more,
Yes,
right?
yes.
And so I'd love to hear about you. You came to Charlotte in 2002. You moved here together from Chicago. Carlos, you're originally from the Dominican Republic.
Originally from Dominican Republic.
And
Santiago.
and here you are. You're in Charlotte and you have been for about 23 years, almost exactly. How did you come here and how have you found it?
Well, Natalie worked after college in Charlotte and had family here. And we also wanted a place that was, at the time when I graduated and finished residency, I wanted to work in mainly Hispanic community and service of uninsured and underinsured. Charlotte was a growing market, Atlanta, obviously California and Texas and other places. But since we were familiar with Charlotte, at that time, Carolina's Healthcare still has a clinic on Eastway Drive, North Park. And I was there for 5 years, really kind of in that community of uninsured and underinsured, mainly Hispanic population. I speak fluent Spanish. So, and then over time, went to Novant and then did private practice, insurance-based, and then ended up kind of really with creating what we've done with Natalie.
Yeah, and I'd gotten my MBA at Chapel Hill, and had worked, as Carlos alluded to, a few years in Charlotte. And we were just really familiar with the area because of that experience and thought this is a great place to raise a family. It had this element of entrepreneurism, which we're seeing more and more of, a young, growing city. And that was very appealing to us. It had a tree canopy, which growing up in New Orleans, I was used to oak trees all around. So it had elements of we can raise a family and there's opportunity here for business and for Carlos to practice medicine. So it all came together and we raised 2 great kids and have launched them. Our last of whom is is now a senior at Chapel Hill. So Charlotte has been, for all intents and purposes, our home.
I appreciate so much the work that you're doing with each other and for the community. And thank you for your time together with me today on the Charlotte Ledger podcast. Thank you.
Thanks, Steve.
That's it for today. Thanks for listening. This episode was produced by Lindsay Banks. You can find out more about the Charlotte Ledger by visiting thecharlotteledger.com.
This episode of the Charlotte Ledger podcast was presented by Childcare Search, helping families find safe, quality childcare with free referrals and support every step of the way.
QueenCityPodcastNetwork.com.